Healthcare innovation often emerges where unmet needs meet new technologies. While shadowing occupational therapists at Singapore General Hospital, I noticed that clinicians were still handcrafting thermoplastic hand splints using methods from the 1970s, which were time-consuming and relied heavily on clinician experience. My research focused on flexor tendon syndrome, where finger tendons become injured or inflamed, causing pain and stiffness. Patients often need custom splints, but these can have sharp edges and deformities, leading to discomfort. This outdated process adds pressure to an already overburdened system. Take Mr. Lim, a 57-year-old contractor for example. He had to wear a splint 16 hours a day, which led to itching and skin irritation. He removed it early, which slowed down his recovery. Hence, I asked, how might we improve this process to boost patient comfort and yet reduce the clinician workload? Introducing Precicast, a novel digitalized splint system featuring 3D scanning and printing. This was co-developed with invaluable feedback from healthcare professionals, Dr. Robert Yap, Head of Hand Surgery at SGH, and occupational therapist Claire Wong. Today, flexor tendon patients receive 3 splints over 3 weeks. Splint 1 is angled at 30 degrees, known as the position of safe immobilization or POSI. Splint 2 is angled at 60 degrees, while Splint 3 is angled at 80 degrees. The current process begins with an A&E triage and 2-hour surgery at SGH, immediately followed by prescribing Splint 1, which takes 1 hour. A week later, Splint 2 is prescribed, which takes 40 minutes. Splint 3 is prescribed a week or 2 later, where the patient is near full recovery. What makes Precicast revolutionary is how it compresses the entire treatment timeline. By tackling the biggest bottleneck, manual splint fabrication, it shifts the process to a semi-automated front end, reducing post-operative fitting time from 60 to 20 minutes. This reduces clinician time by 3 hours a day. Step 1 starts with 3D scanning the patient's hand at admission, generating a detailed mesh of the injury. While surgery proceeds, Step 2 allows doctors to adjust splint parameters using a custom grasshopper script, optimizing splint topology for the wound. To ease adoption, Precicast keeps familiar clinician workflows where hand-drawn reference lines are translated directly into the digital interface. Finite element analysis ensures each splint meets the desired structural integrity. Over 20 prototypes were developed. Some failed under pressure, others lacked usability. I explored new materials like PETG and thermoplastic urethane. The final design uses a breathable lattice structure printed in medical-grade PETG, where it resists warping, withstands impact, and deforms only at 130 degrees Celsius, compared to 70 degrees for current materials. Beyond hands, Precicast scalable system can potentially adapt to other body parts, shifting clinical focus away from fabrication and back towards patient-focused outcomes.